and welcome to Palm Beach Senior Chat. My name is Marina Ramirez, and today we have Casey Uritis.
Yes.
Oh, I did it correctly. She's a occupational therapist with Saylor, and we're talking about Parkinsons and Big therapy.
Yes.
There you go. So, first of all, Casey, tell us a little bit about you, please.
So, I'm an occupational therapist, and I like to always explain what that is, because a lot of people don't know. So, a little bit of difference between OT and PT is that occupational therapists specifically work on your function in your daily tasks. So, things that we call our ADLs, so dressing, bathing, feeding, even anything down to, picking up your grandkids or going, walking to the store, different things like that. So even though PT and OT kind of overlap, we still do, range of motion, we look at strength and all that good stuff. Our main focus is to make sure that our patients and clients are as independent as possible in our ADLs and different things that we kind of take for granted. So that's kind of what I do. I work in an outpatient facility, like I said, Saylor Physical Therapy, and there's a big kind of umbrella of what OT does, but today we're going to talk about our LSVT Big program for Parkinson's disease.
Okay, so first of all, let's talk a little bit about Parkinson's disease.
Sure.
I am a little bit acquainted with it. My father-in-law had Parkinson's. What does Parkinson's do to a patient's brain?
So what Parkinson's does, what happens is that people start perceiving some, what we call our gaits or our walking and different motions, even fine motor, so like buttoning tasks, dressing tasks, and even just movement. Our brain starts to perceive that smaller movements are normal. So what you see in Parkinson's, especially, there's all different kind of layers and levels of Parkinson's, but as when someone starts progressing through the disease, unfortunately, we start seeing these kind of abnormal movements that can lead to balance issues and slow walking and really soft speech where they can't be understood and different things like that. So what we do with the LSVT Big program is that we kind of try to rewire the brain to realize, hey, these are actually abnormal, but we need to move bigger, we need to do bigger movements in order to kind of have a more normal kind of way of walking, way of life to kind of hopefully prevent any kind of falls that could lead to hip fractures or further brain injury or shoulder issues and different things like that and overall safety.
Yeah, I mean, we were talking earlier and I thought that Parkinson's affected how a person moved, but what you were explaining to me is that it's how the brain perceives those motions.
Yeah.
That was very interesting. So how is LSVT Big implemented?
So what LSVT Big is that it's a one-on-one therapy with a certified LSVT Big clinician. So it's usually going to be with an OT or PT, and it's totally one-on-one, and it's actually 4 times a week for 4 weeks. So what it does is that in that hour session you're with the therapist, we're implementing a series of exercises that are going to encourage bigger movements overall in the entire body as well as speech, and the hope that we can kind of retrain the brain to develop and actually make these habits more habitual on a daily tasks so that we can kind of prevent any falls, any further kind of smaller movements, overall increased safety and overall increase in independence with those ADLs again on a daily basis.
And after the 4 weeks are over, what happens?
So after the 4 weeks are over, we actually hope to give you all these exercises. So we're going to give you all these exercises or your caregiver all these exercises. And what you're going to do is that just like you were going to go to the gym, we're going to have a little regime that you're going to hopefully implement on a weekly basis and you're going to upkeep with these exercises. So what we do is just kind of, I like to explain it, if you go to the gym, so when you stop doing your exercises and workout, that kind of goes away.
Correct.
So same thing with here. It's a series of exercises that we want to implement on a daily basis, so then that way we can kind of keep our goals, keep everything that we got.
How long do they take on a daily basis? How long are those exercises?
When you get it down packed and it's in your memory, it can take 10 to 15 minutes a day.
So nothing at all. And then do they go back for refresher courses with you guys?
Some people do. So we actually encourage people to touch base with us every couple of months. So anywhere between 3 to 6 months, you can just kind of shoot, us an email or a call or something like that. Just kind of touch base to see how you're doing. Some people, maybe a year, 2 years down the line, notice that something's getting a little bit harder. So again, Parkinson's, unfortunately, is a very progressive disease. So, something that may have been a little bit easier at the time of therapy in 2 years' time may have become a little bit harder. So we'll have people that come in for tune-ups, and we'll kind of reassess everything that's going on, reassess how they're, moving and their overall mobility and independence are, and then we can kind of implement where we see fit therapy.
Is there a certain level of Parkinson's that would not benefit from the Big therapy?
Nope. So there's a lot of research articles in LSVT Big. The more and more it's getting a lot popular really lately. And what we notice, obviously, the earlier we can get someone in and implement these exercises, then the better outcome there is. However, there's never too late. So
never too late.
Nope. So all the exercises come with adaptations. Okay. So we can do anything from someone who's good with standing and balance to anything, someone that's a little bit more involved to being in the chair, even into the bed. So we can kind of do it and modify it as need fit.
And how do I know if me or my loved one would benefit from Big therapy?
The way I like to tell people is if you just you go on lsvtglobal.com and we'll kind of supply all that information. You find a clinician in your area that's certified and you just give them a call. You talk to them, you see if it's appropriate. They'll be able to kind of give you some feedback to see what they think. You can also even talk to your neurologist. A lot of neurologists are, more aware of this therapy as well, and they can kind of give you some input too.
Well, our audience will have your information on the website, so they can definitely reach out to you and to Saylor. And let me just ask you, where was this developed and how? Because you were telling me it's such an interesting story.
Yeah, so it was actually developed from a speech therapist. So it originally was LSVT Loud, which kind of is our sister partner. So a lot of time with Parkinson's, not only does their physical attributes change, but their speech changes. So they have really soft-spoken people. They start complaining about people can't understand them. So the speech therapist developed this LSVT Loud program in a facility and then had OTs and PTs nearby who thought it was great and said, hey, we can do a lot of things with the body as well to make, improve function. So that's kind of how it started. And then we, the LSVT founders actually started doing a lot more research and different things like that and noticing that compared to other therapeutic regimens that this is having the best outcomes for patients with Parkinson's.
Excellent. Well, thank you so much, Casey, for coming here today. This has been fantastic. We've learned so much. And thank you to our audience, and we'll see you again next time. This is Palm Beach Senior Chat, and this is Marina Ramirez. Thank you so much.